This recording will go over pediculosis or lice, as well as scabies and frostbite. Lice are small, blood-sucking insects, approximately 2 to 4 millimeters in length. Pediculosis refers to infestations of lice on the scalp or body. Although pediculosis is not a serious health problem, it can cause embarrassment and often elicits an emotional reaction among parents and school personnel who mistakenly associate it with poor hygiene. Head lice is not known to be responsible for the spread of any disease, although body lice is known to serve as vectors for several pathogenic bacteria. Lice live only on humans and are transmitted by direct contact with infected persons and contact with infested objects such as brushes or hats. Lice cannot jump like fleas, and clean hair is no deterrent to head lice. Pediculosis capitis is head lice. Nits are visible and are attached firmly to hair shafts near the scalp. They are tiny, silvery or grayish-white specks resembling dandruff, but they are more difficult to remove. They are commonly found behind the ears and at the nape of the neck. Adult lice are difficult to see because of their small size and the fact that they crawl very fast to avoid light. Scattered lesions on the scalp, behind the ears, or on the back of the neck cause intense pruritus. Secondary scalp infection can develop from scratching. Pediculosis corporis is body lice. Pediculosis pubis is pubic lice or crab lice. The diagnosis of head lice is made by identification of nits or lice on the scalp. The examiner parts the hair with two tongue depressors and moves it from side to side and front to back, paying particular attention to the crown, behind the ears, and at the nape of the neck. Unlike dandruff, nits are not easily removed from hair shafts. An over-the-counter pediculicide, permethrin 1%, kills head lice and pubic lice and eggs with one application and has a residual activity, meaning it stays in the hair after treatment, for 10 days. It is applied as a lotion or shampoo, and it can be rinsed out after 10 minutes. The hair should not be shampooed for 24 hours after treatment. Even though the kill rate is high and there is a residual action, treat the hair again after 7 to 9 days. And that's important because usually one dose is not going to treat the hair completely. So in terms of patient teaching, they need to know that a second application is going to be necessary. Environmental objects, clothing, and bedding should be treated or washed. It is important to examine family members or others who might be in close contact with the infested child. Only those with an observed infestation should be treated. The parents need to notify the school if a child has an active case. Meticulous vacuuming of carpets in classrooms with affected children will help prevent transmission. We can teach parents to remove nits by backcombing with a fine-tooth comb. 1 hour before combing, nits can be loosened with a mixture of half vinegar and half water. It is easier to comb a child's hair for nit removal when the hair is damp rather than wet or dry. Advise parents to wash clothing, especially hats and jackets, beddings and linens, in hot water and dry them in a hot dryer setting. Dress-up clothes, hair ornaments, bicycle helmets, batting helmets, headphones, and similar objects should also be treated. Items that cannot be washed should be dry cleaned or sealed in a plastic bag for 3 weeks. The parents should vacuum floors, play areas, and furniture to remove any hairs that might carry live nits. Combs and brushes should be boiled and soaked in anti-lice shampoo or hot water for at least 10 minutes. Routinely teach children not to share hats, combs, or hair ornaments with other children. The child should be rechecked for infestation in 7 to 9 days. Advise parents to call the physician if itching interferes with the child's sleep, if the condition does not clear up after 1 week, or if scalp lesions look infected. Please review the purple nursing care box for the child with pediculosis on your own. Scabies is a contagious condition that has been recognized for many centuries. It results from infestations of a mite. Scabies is transmitted by close personal contact with infected persons. Those who share a bed or live in crowded conditions are likely to transmit scabies to each other. The scabies mite cannot survive for more than 3 days away from human skin. For that reason, transmission of scabies by bedding and clothing is infrequent. Scabies is widespread throughout the United States and prevalent in many schools. All socioeconomic groups are affected. The female mite burrows into the epidermis, lays her eggs, and dies in the burrow after 4 to 5 weeks. The eggs hatch in 3 to 5 days, and the larvae migrate to the skin surface to mature and complete the life cycle. The mites, eggs, and their excrement cause intense pruritus. One of the major complications of scabies is impetigo resulting from the scratching. Intense pruritus occurs especially at night. Infants may be cranky, sleep fitfully, and rub their hands and feet together. Burrows, or fine grayish thread-like lines, can be difficult to see because they are usually obscured by secondary changes of excoriation and inflammation. Papules, vesicles, and nodules are common and are located mainly on the wrists, in the finger webs, on the elbows, in the umbilicus, in the axillae, in the groin, and on the buttocks. In infants, the head, palms, and soles may also be affected. The characteristic skin eruption and a history of intense pruritus, especially at night, are suggestive of scabies. The diagnosis is made by microscopic examination of scrapings of the lesions. Scabies is primarily treated with a topical application of permethrin 5%. The medication is applied to the body and head, depending on age, avoiding the eyes and mouth. The medication must remain on the child for 8 to 14 hours, depending on the medication prescribed, to be effective, so applying it at bedtime is recommended. It is washed off in the morning. Retreatment in 1 week is usually recommended. Pruritus lasts for several days to weeks after treatment and can be relieved with corticosteroid cream and oral antihistamines. Family members, even if asymptomatic, and daycare contacts should be treated. The child's bedding and clothing should be washed in hot water in a fashion similar to the environmental treatment for pediculosis. Nursing care of the child and family with scabies is similar to that for pediculosis. Inspect the child's hands, elbows, umbilicus, groin, and buttocks for burrows. However, burrows are sometimes difficult to see, and persistent itching may be the only symptom. Evaluate an adolescent with scabies for STDs. Instruct parents to use the scabicide according to the manufacturer's instructions. Infants should be clothed during treatment so that they cannot lick their skin. To minimize absorption and the risk for toxic effects from certain medications, medicated lotion should not be applied for at least 30 minutes after bathing and should be applied only to cool, dry skin. Advise the parent that persistent itching after treatment is expected for approximately 2 weeks and is not a sign of reinfestation or an indication for repeated application. Scabies is usually cured with one treatment. However, a repeat application in 1 week is recommended. Clothing and bed linen should be dry cleaned or washed in hot water and dried at a hot, drier setting. Freezing of tissue resulting from exposure to extreme cold is known as frostbite. Exposed areas such as fingers, toes, nose, cheeks, and ears are most often affected. Cold causes arteriolar vasoconstriction, resulting in tissue anoxia and destruction. Manifestations can include early signs such as blanching of the skin, stinging sensation followed by numbness and white, mottled appearance. Areas feel cold, hard, and may be without sensation. Frostbite can progress to the point of complete necrosis with gangrene and possible loss of body part. Children in cold climates should be taught to prevent frostbite by wearing adequate warm layered clothing, hat, gloves, and 2 pairs of socks, 1 cotton and 1 wool. Children should be taught to warm themselves when hands or feet begin to sting. Young children should not be allowed to play outside in extremely cold temperatures. In terms of management, immediately cover affected areas with warm hands and warm clothing. Massaging areas could cause further damage and should be avoided. Rapidly rewarm areas by immersion in warm water bath, 90 to 106 degrees Fahrenheit, until all frozen tissue appears thawed and the skin appears flushed. Pain during thawing can be severe and should be treated with analgesics and sedatives. Severely damaged areas are treated as burns. And here's just a clip of your PowerPoint slide on frostbite. And here's your end of PowerPoint question. Please pause the video and read the question and pick out your correct answer and then resume to see if you are correct. For this question, the correct answer is D as in dog.